Soldier position. The soldier position describes sleeping flat on the back with both arms resting straight alongside the body. It gets its name because it resembles the posture of a soldier standing at attention. This is one of the least common sleeping positions, but it naturally keeps the spine, neck, and head in a fairly neutral alignment when the right pillow is used. That can reduce pressure on joints and help prevent certain types of neck or back pain. At the same time, sleeping flat on the back may increase snoring and can make sleep apnea symptoms worse in some people because gravity allows the tongue and soft tissues to fall backward into the airway. For those without breathing issues, however, it is often considered one of the more balanced positions for overall body support. Sleep specialists also point out that a small pillow placed under the knees can reduce strain on the lower back by helping maintain the spine's natural curve. Even though this position is uncommon, people who naturally sleep this way often wake up with fewer pressure points because their body weight is distributed evenly across the mattress. Back sleeping. Back sleeping is a broad category that includes several variations, including the soldier position. Many people sleep on their backs with their arms in different positions or with a pillow under their knees for added comfort. This position spreads body weight evenly across the mattress, reducing pressure on the shoulders and hips. It may also help reduce facial wrinkles over time since the face is not pressed against a pillow for hours each night. However, back sleeping is not ideal for everyone. People who snore heavily, have obstructive sleep apnea, or are in the later stages of pregnancy are often advised to choose another position. Small adjustments, such as using supportive pillows, can make back sleeping more comfortable and better aligned. Mattress firmness also plays an important role. A mattress that is too soft may allow the lower back to sink, while one that offers balanced support can help the body remain in a healthier position throughout the night. Fetal position. The fetal position involves lying on one side toward the chest and the body gently curled. It is one of the most popular sleeping positions around the world. The name comes from the way babies naturally rest before birth. Sleeping this way often creates a feeling of comfort and security, which may explain why so many people naturally choose it. Side sleeping can also reduce snoring and help keep the airway more open. If the body curls too tightly, though, it can place extra strain on the neck, shoulders, and lower back while limiting deep breathing. Keeping the knees only slightly bent instead of tightly tucked usually provides better support while maintaining comfort. Many people find that placing a pillow between the knees further improves spinal alignment and reduces pressure on the hips, especially if they remain in this position for most of the night. Log position. The log position is another form of side sleeping, but here the body remains relatively straight with both arms resting alongside the sides. From above, the body resembles a straight log, giving the position its name. Because the spine stays more aligned than in a tightly curled posture, many people find this position comfortable for long periods. It also reduces pressure on the back and may help decrease snoring compared to sleeping flat on the back. The shoulders can sometimes bear more weight, especially if the mattress is too firm or the pillow does not properly support the neck. Choosing the right mattress and pillow often makes a noticeable difference for people who prefer this posture. People who frequently wake with shoulder discomfort may benefit from a mattress that allows the shoulder to sink slightly while still supporting the rest of the body. Yearner. The Yearner position also involves sleeping on one side, but with both arms stretched forward as though reaching toward something. It is named for this reaching appearance rather than for any emotional meaning. Like other side sleeping positions, it often supports easier breathing and may reduce snoring. Some people find that extending the arms creates a more open feeling through the shoulders and upper body, while others notice stiffness if the arms remain outstretched for too long. Pillow placement between the knees can improve hip alignment and reduce pressure on the lower back, making this position more comfortable throughout the night. Since the shoulders remain slightly forward, choosing a pillow with the correct height helps keep the neck aligned and reduces the chance of waking with stiffness. Left side versus right side. Both left side and right side sleeping share many of the same benefits, yet each has some unique effects. Sleeping on the left side is often recommended during pregnancy because it may improve blood flow between the heart, the placenta, and the growing baby. It can also reduce acid reflux for some people by helping keep stomach contents lower than the esophagus. Right side sleeping remains perfectly healthy for many individuals and may feel more comfortable depending on existing shoulder pain or personal preference. In certain heart conditions, doctors may recommend one side over the other based on individual needs. For most healthy adults, however, the difference is relatively small, and comfort, proper support, and good sleep quality matter far more than choosing one side exclusively. Instead of forcing yourself to sleep on one particular side, it is usually better to choose the position that allows you to sleep comfortably through the night while keeping the neck and spine properly supported. Stomach sleeping. Stomach sleeping places the body face down against the mattress, with the head turned to one side for breathing. While some people find this position comfortable, it is generally considered the least supportive for the spine. The lower back often arches more than usual, and the neck remains rotated for hours, which can contribute to stiffness or soreness after waking. On the positive side, stomach sleeping may reduce snoring in certain people because the airway stays more open than when lying flat on the back. Those who cannot comfortably switch positions may benefit from using a very thin pillow or even sleeping without one under the head to reduce strain on the neck. Placing a small pillow beneath the hips can also lessen pressure on the lower back and improve comfort for people who naturally return to this position during sleep. Pillow hugging. Pillow hugging is not a separate sleeping posture, but rather a habit that can accompany side sleeping or other positions. Holding a pillow against the chest or placing one between the knees changes how the body is supported during sleep. For side sleepers, hugging a pillow can reduce pressure on the shoulders and help keep the upper body aligned. A pillow between the knees can also decrease twisting through the hips and lower back. Many people naturally adopt this habit because it feels comforting, but it also has practical benefits by helping maintain a more stable sleeping posture throughout the night. Body pillows have become especially popular for this reason, providing support to multiple areas at once and making it easier to maintain comfortable alignment for several hours. Combination sleeper. A combination sleeper changes positions several times while sleeping instead of remaining in one posture all night. This is actually very common. During normal sleep cycles, people naturally move to relieve pressure on muscles and joints without fully waking up. Frequent movement is not necessarily a sign of poor sleep. In fact, changing positions can improve circulation and reduce discomfort from staying in one posture for too long. The challenge for combination sleepers is finding a mattress and pillow that remain supportive regardless of whether they are sleeping on their back, side, or stomach. Balanced support often matters more than choosing one perfect sleeping position. Sleep experts generally view occasional movement during the night as completely normal since the body naturally adjusts itself to remain comfortable as sleep progresses through different stages. Elevated sleeping. Elevated sleeping means resting with the upper body raised above the level of the legs, usually by using an adjustable bed, a wedge pillow, or carefully arranged pillows. Doctors have recommended forms of elevated sleeping for many years to help certain medical conditions. Raising the head can reduce acid reflux by making it harder for stomach acid to travel upward during the night. It may also improve breathing for some people with congestion or mild sleep apnea, and reduce swelling in certain situations. The key is supporting the entire upper body rather than bending only the neck, since poor positioning can create discomfort. When used correctly, elevated sleeping can improve both comfort and sleep quality for people with specific health needs. It can also make getting in and out of bed easier for people recovering from surgery or dealing with certain mobility issues. As with every sleeping position, the best choice ultimately depends on the individual's comfort, overall health, and the support provided by the mattress and pillow.